color, and you might have to figure out what color, is it a natural color or not? And you can ask that question. Are they beginning to gray, depending on their age? That comes into play. So describe the color. Texture and distribution. Is there even distribution all over? And okay, who wants to be the example?
I'll bet.
Okay.
I'll help me remember.
Oh, that's very true.
He's got grays too.
Okay.
He's got gray.
Say his hair is
Brown.
okay.
Black.
Dark brown.
Dark brown. Okay, and is it a natural color?
Yeah.
Okay.
Sorry.
Is it for natural hair color? Yeah.
There's some gray.
Okay, and, okay, so then he's not graying.
Down here.
Mhm.
Maybe do one or two, but, okay, they just show fall and dark hair. Texture, okay, so I'm gonna feel his hair, and his hair is actually kind of coarse. He's got waves. Kind of shiny a little bit. Does he have any scalp lesions? So just like when we did the other the checkoff we just did, you're kind of have to look through, see if you see anything in there. A lot of hair. Is it thinning in any area? Is there an even distribution? And of course, as so, you're going to see thinning in different areas. Like the male pattern baldness is in the more in the crown, here, and often women after they go through menopause, you'll see some that you can see their scalp. What you can do about it. So you might see that too. So that's important to note. Okay. Okay, skin. We're going to do upper extremities. Okay, what color is the skin?
Check
Tan.
this card right here. Yeah, you're hydrated.
You know, one way to assess your patient, when you're doing this thing, take the back of your hand and take it down. You can check for the smoothness, for the warmth, for moisture. You do it on both sides at the same time.
Try.
Would you document like his color would be like tan and one and then kind of pale and the others? Yeah. That
Farmer's tan.
farmer's tan.
I don't know, Kathy, how would you describe that?
Why do I bring him white?
Farmers can
Two
steal.
times.
He has an ombre.
I mean, his skin color,
Really, really
he's generally even,
It's
Caucasian,
Yeah, just
pinkish tan in color.
chew on
Ombre.
farmer's
Unless there's like patches, right?
Right.
Reverse
Right.
ombre,
So it's
though.
not-
It's a
there's not
reverse
an
ombre.
abnormality of, and you need to look at all their skin. I'm not gonna have you take your shirt off though.
Take it off.
Does he have freckles or moles present? He has some moles and freckles. Those are, is an even distribution of hair on his arms. See my guide here. Temperature, what's the temperature? It's cool to touch. I would check both sides, of course. No moisture. Texture, he's actually got smooth skin. However, as people age, their skin changes, and there are those who their skin is dry, flaky, thin, transparent, and a lot of our older folks, as you start losing your collagen as you age, the skin becomes more and more transparent, and you see it in hands and arms probably first. Okay. Thickness, okay, like I said, aging, you get more transparent skin, you're gonna see a lot of transparent skin in the long-term care facilities. His normal thickness appears well hydrated because his skin turner is good.
Hers for Christmas.
Okay. So looking at upper extremity, that's what we're gonna look at. At his hands and nails, we're going to look. Okay, so I'm gonna inspect the nails all the way around, and on both hands, obviously. And his nails look clean. I don't see any abrasions, bruising, anything like that on his nails. His fingertips are cool, and often your fingertips and toes might be cooler than the rest of your hand. Okay. There's no, for him, okay, you can do like this to check for clubbing. So if there's clubbing, okay, I don't have clubbing, but if you, I'm just gonna say, is there a picture in here? You can see clubbing. Clubbing, do you guys know what causes clubbing?
What is it?
Pardon? No, not really. It's from oxygenation, that poor oxygenation throughout their life. Like people with COPD, you'll often see clubbing of the nails.
Like curve?
Yes.
Let me see.
Yeah. Okay.
Wait.
It's on 218.
I thought clubbing was.
Okay, we want to check capillary refill. Do you guys know how to check capillary refill?
Press down and
Squeeze.
feel.
Right, and see how quickly it comes back.
Like
Which
a
also
rubber.
gives you, it's a good sign of perfusion. Are we getting an adequate amount of blood flow to determine? Take Brevicin anemic. There you go.
Wow.
And, sometimes with feed too, if there's poor venous return, then their perfusion's not as good either. So that's something you want to look at. In an acute person who is in a like ICU setting, wherever, I mean, you can tell by their perfusion very quickly if someone's doing well or not. And sometimes the perfusion, just from checking their perfusion, it's like, we're not doing well because there's not adequate blood flow. Okay. We need our radial arteries. You guys know where the radial artery is? You should know. We've been checking pulses. Do we know where the brachial artery is? Okay. You do CPR, that's a good place to check. Because you also should be, you can know that blood pressure. Period. Okay, are my pulses equal? We've done pulses, so we know how to do that. Questions about any of that? Yeah.
A lot of it's the same as for the upper extremities. You're going to look at the legs, you're going to touch them, you're going to compare warmth, if there's any edema. Edema means swelling in the lower area. So you look at size, look at the hair. If you have hair that's thinning on the legs, it could, in younger people especially, could be some disease process that's going on. Because you're diabetics, they may have less hair on their legs. It's all part of the process, or there's other reasons too. So we're going to look at color, temperature, moist texture, and thickness of the lower extremities, just like you did the top. And then you're going to check and see if there's any pretibular edema. So you will look at the lower legs, and you can look for any kind of edema. And quickly, if you just have heart failure patients, you're probably going to see some swelling down in here. And as the condition gets worse, you may see it coming out. Okay. Now, there is such thing called pitting edema. And that's when you push on it and it leaves your finger indented. Now it goes back to normal after a while. But there's different degrees. There's 1+. Are you tape recording me? Oh man, you guys.
I have pitting edema all the time when I use my leg.
You do?
Yeah,
Go ahead.
I always have since I was 20.
Don't go anywhere.
Is there something that goes along with that for you?
What's that?
Is it like a circulation issue, or is it just?
I my thinnest days of underweight even, I've always had pitting edema.
What's it feel?
Yeah, you can push on it.
What do they rate that as?
Everybody says.
You ever hear about
Oh my goodness.
No one's ever said anything, I just noticed it.
That's pitting edema, and then dip on 215 in your book, in Jarvis, on the big book. It tells you the different
You can really push. Isn't that gross?
You know, I'm wondering if that's about a 3. Three or 4. If it's a mild edema, or one place is mild edema, and has a slight indent when you push. 2 is moderate, and you have an indent that subsides quickly, which hers, it took a few seconds.
I think it's
3, yeah, that's what I was
I think
thinking.
it's probably
Deep
3.
pitting and bending, it stays for a short time. That's what I was thinking too.
Yeah.
4 is very deep indent and lasts for a long time. And that's all in your book on page 215, the big book. So that is something you will be doing. And that's some of the description words you can use when you're documenting. You want the patient to stand, and you're going to look at the venous patterns in their legs, just like you did on your critiquing this week, or my students did.
I'm just messing with my phone right now.
Okay. You're going to look at lesions. So I'm going to examine both legs. I'm going to look for open areas, anything abnormal on his legs. I'm going to look at both of them all the way down. You're going to look at the nails in the feet, just like you did with the fingernails. You're going to notice that on toenails, your older patients, their nails may be thick and brittle, and that is somewhat due to the aging process, but also could be the disease process, depending on your patient. Ridges could mean something on their nails. Your book goes in more detail about that. Now your capillary refills a little bit different on the toes versus the fingers. If you look on your sheet, you should have a capillary refill within 2 seconds on the fingers, but it's 3 seconds on the toes. And did you show them how to do a capillary refill?
Yeah, on his arm.
Okay.
But you can squeeze his toe.
I'm not going to touch his toe. But when I do this, it should go back. And with the lower extremities, it'd be less than 3 seconds. Look at that fingernail polish. I mean, what you remove it, what you can do. I would do it right, and if I didn't have any fingernails at all, I would do it here. Right up in here. Push on it.
There's one way to do like perfusion and their capillary refill.
Okay. And then you have pulses. And again, you're going to compare them back and forth, just like you did with the radial and the brachial. Then you have the first one there, and we call that the pedal pulse. It's a dorsal, what do you pronounce that?
Dorsalis, wait a minute, where are we?
We're on the pedal pulses.
Dorsalis, pedis artery.
Yeah.
Where
Where
on
would,
our quiz?
okay, good. Do you know where that's at on your foot? Take your shoe off. Everybody take a shoe off and feel for it. And we go right up in here. Go between the big toe and the first toe and go straight up. And you'll find it right about there. You want to make sure they have one, and you want to make sure the other foot has one. And you're going to compare the strength on them. The next one is the tibia. And on that one, it's on the inner part, down in here. On the ankle part. And I'll show you a picture of, I thought it was really good on that. Femoral arteries, you're going to look, it's in the groin area. Now, I'm not going to make my students, and I know Jane probably won't either, point, you're just going to point on yourself where you're going to find the femoral. But it's right there in the groin area, okay?
So find your femoral arteries on your own.
On your own body. Take my picture out of there. Really good.
All done.
Did we go through it all?
In Nikki, we
Yeah.
used to do, occasionally do like